Hi, and welcome to the Neigel Center for Cosmetic and Laser Surgery. I'm Dr. Janet Neigel, a board-certified oculofacial plastic and reconstructive surgeon. I've been in private practice for over 25 years, specializing in facial rejuvenation. Whether I see patients for medical purposes or for cosmetic and aesthetic services, all my patients have one thing in common. They, along with myself, are all aging. Over the years and to date, there have been tremendous advancements in facial aesthetics and rejuvenation treatments, laser technologies, and skincare products. However, the one area of cosmetic aesthetics that hasn't changed over the years, decades for that matter, is the patient's desire to grow older more gracefully while looking as youthful and ageless as possible. The word aging means something different to everyone, and depending on what decade of life a patient is in will often determine the approach we will take to address their concerns. In my practice, I typically see three types of aging patients: those that want to prevent aging, which I call the early preventative patient; those that want to fix something, which I call the refresher patient; and lastly, the patient that wants to look like they did 5 to 10 years ago. To freshen up an aging appearance, I call these patients the correction patient. Let's talk about the early preventative patient. These patients are often in their 30s to early 40s who are aware of and are concerned about the early signs of fine lines and wrinkles. They may also have noticed changes in their skin tone, texture, and clarity. The early preventative patients are often interested in non-invasive, non-surgical treatments such as Botox or Dysport to smooth out frown lines or crow's feet and help prevent the further development of deeper fine lines and wrinkles at a faster pace. In addition, I often will use dermal fillers such as Juvederm or Restylane to maintain the current look of their facial features. The early preventative patient is committed to maintaining healthy-looking skin with the monthly aesthetic services such as microdermabrasion or a chemical peel, and by using topical medical-grade skincare products such as Skin Medica and my own Neigel Center line of skincare products to attain a healthy complexion. The refresher patient typically is between 40s and 50s. These patients have noticed that along with the occurrence of fine lines and wrinkles, they are noticing the signs of a sagging neck, a double chin, or the development of jowls along the jowline. These patients are often the most proactive and the most anxious to correct these concerns before they become more apparent and surgery is needed. Often I may suggest to the refresher patient a product known as Sculptra. Sculptra is our liquid facelift and helps stimulate and replace the loss of collagen in the skin that has been depleted over time or from other elements such as the sun. To add fullness to the loss of volume in the cheek area or the apex, I like to use Voluma dermal filler. Once injected, patients immediately see high cheekbones again. Recently, Kybella was introduced into the aesthetic market to treat patients with submental fat or a fullness under the chin, that giving them a double chin. Whether patients develop the submental fat from heredity or the aging process, once a series of Kybella injections has been administered, patients can expect to see an improved and contoured facial profile, chin, and jawline. Lastly, the third type of patient I see is the patient who is 50 to 60 plus and has prolonged the need for surgery over the years with non-invasive, non-surgical rejuvenation treatments and is starting to consider something more permanent. These patients I refer to as the correction patients. The natural progression of aging may contribute to the loss of bone structure, allowing for the occurrence of a sagging face. Extra skin and a heaviness above the eyelids may develop, and the under eyes may have developed puffy bags and loose skin. When these concerns are prominent, my patients and I will have a consultation to discuss the best solution to their aging concerns. To address the sagging face and broken jawline, I may suggest a surgical treatment known as the S-lift, a modified version of the traditional facelift, which I have perfected over the years. This allows the patient a quicker recovery, smaller scars, and less downtime. The S-lift turns back the clock 5 to 10 years and a more youthful appearance. To address the drooping eyelids or puffy under-eye bags, I often recommend a blepharoplasty, otherwise known as eyelid surgery. I also will suggest that the correction patient consider combining a fractional laser resurfacing treatment if they are undergoing a surgical treatment. This treats sun-damaged skin, fine wrinkles, and brown spots, in addition to greatly aiding in the preservation, rejuvenation, and longevity of healthy skin. I hope you've enjoyed learning and understanding the aging process and the treatments available at the Neigel Center. Our philosophy is that it's never too late to start making a difference and taking your natural beauty to the next level. After all, growing older happens to all of us. How we choose to age is optional. Thank you.